this is quite interesting. Our first forum of the day is Practice Medicine Differently. Please welcome our moderator on stage, Dr. Faridah. Welcome on stage, Doctor.
Thank you very much, Mr. Chairperson. Good morning everyone. I'm Dr. Faridah from MSU Medical Center. I welcome everyone. We're going to have a good discussion on our topic today. But before that, I would like to invite all the panelists, please. We have Dr. Ellise, Dr. Iman, and Dr. Prakash. Alright, so as we all know, the topic today is about practice medicine differently. Alright, so we're going to talk about how, moving from sick care to health optimization. So for decades, we know that medicine has been invented to actually treat the sick people, but now there are increasing awareness on prevention of diseases. So today, our panelists will share on their reflections, their experience and ideas on how we can move from a reactive model, which is looking after the sick persons, into empowering and human-centered approach and actually going into health optimization. Alright, so before we start, I would like to invite each of our panelists to give an introduction about themselves, especially about their practice, how it is related as disruptive doctors. So that will be interesting. So we'll start with Dr. Prakash.
Hello everyone, thank you Dr. Faridah. Okay, my name is Dr. Prakash. I'm basically a GP running my own practice. So besides my GP practice, I've started integrating lifestyle medicine into my practice. And the latest innovation that I've done in my practice is I've started to introduce CGM for diabetic patients for better diabetic control. Thank you.
Hello everyone, good morning. Thank you Dr. Faridah. So I am a functional medicine, I'm Dr. Iman Thalia, I'm a functional medicine doctor and I'm the medical director and the co-founder of the Rosewood Clinic. So we are a functional medicine clinic, a group of doctors practicing functional medicine and it's basically looking at the root cause of disease rather than managing symptoms, so identifying and addressing root cause. And we deal with a lot of complex cases. Usually patients who come to us have already been everywhere. And so basically, it takes a lot for us as well because, it's, looking at multiple, causes and identifying basically why these symptoms happen in the first place. Yeah.
Thank you, Dr.
Hello everyone, good morning. It's not a really big crowd here. In case you don't know, I am Dr. Ellise. I practice in my own clinic Dr. Ellise. I focus in private health that mainly in lifestyle medicine. So every day I will spend time talking to my patients how to have their lifestyle behavior change in order to bring longevity to their life.
Alright, thank you. So shall we start with Dr. Prakash? What does health optimization mean to you?
Okay, for me, health optimization means try as much to move away from this conventional treatment using medications, and so we focus more on prevention, where of course prevention is better than cure, right? Everyone knows. So, number one, we try to prevent the disease before it comes. Number two, we try to empower our patients, empower their health by increasing their awareness and increasing their participation in healthy lifestyle, advocate a proper healthy lifestyle. And also we try to incorporate habits that is more sustainable. That means instead of giving them a lot of things that they cannot sustain, we build a small habits that is more sustainable in daily life to maintain their health and to prevent any diseases.
Okay, thank you. Can we get the same question to Iman, because her practice is a little bit different here, right? So we want to know in the functional medicine point, what do you mean by health optimization?
Okay, so I like this question because our current healthcare system is built to treat and manage diseases. It's not meant to look at health and restore health or optimize health, right? And so looking at health optimization is looking at things upstream, what we can do to optimize our health before things happen. So it's not waiting for a crisis to happen and intervene. So we're looking at things before disease can manifest. In terms of functional medicine, there's a lot of things that we do. We do a lot of testing, looking at advanced biomarkers, looking at multiple things like gut microbiome imbalances, inflammation, toxin exposures, hormone imbalances. So of course we do a lot of testing, and also for example, patients with diabetes, for example, if I prescribe them with metformin, it's definitely going to lower down the blood sugar levels, right? But if I prescribe this patient with a lifestyle change or a Mediterranean style diet, right, it's not just going to lower down the blood sugar, but it's also going to tackle a lot of different things like lowering down inflammation, helping with blood pressure, lowering down cholesterol levels. So you're sort of killing multiple birds with one stone, right? Yeah, so that's what I would say in terms of health optimization. It's not just increasing your lifespan, you want to also increase your health span. All right, so that's what I would say.
Thank you, very interesting answer. So can we move to Dr. Ellise then? So why is it important that we actually move beyond treating illness?
Beyond treating illness, why is it important? Of course it is important because as our population is getting more mature, I wouldn't say older, we tend to see that nowadays people are living very long, but the last 10 years, they have no quality of life. They are in out hospital. So I always will set a goal with my patient. If let's say they come all the way to see me, I would like to ask them, what does health mean to them? So what do they want? So from there I work out. Let's say there will be some people that who wanted to have more energy. It can be as simple as that. Or they experience fatigue as you hit the age of 40, 50. They will say that I have less energy compared to last time. I didn't sleep well. That's how I incorporate lifestyle medicine into my practice, that by changing the hour you sleep, by changing the food you eat, by increasing your daily movement, you can bring a big impact, not only for their current life, but for the last 10 years of their life. They are able to stand upright, they are able to reach for the shelf, they are able to carry the grocer, they are able to, the best joke that I always say, if let's say at your last 10 years of your life, you want to go to the toilet and sit up, you go to the toilet, you sit down on the toilet bowl and you want to stand yourself out without using the handrail. That's why lifestyle medicine is so important, why you need to preserve your muscle mass.
Yeah, very interesting. It's just that in prevention, it's not only making you live longer, it's more about living in a better quality of life, right? Okay. So it seems like in this, what all our panelists is practicing, it seems like there are a lot to do in one consultation. Do you think so? So we just wonder, this is the second part of our discussion, is how in practical that they are putting all this, trying to tackle so many things in a consultation together with seeing so many patients. All right, so we'll start with Dr. Prakash.
Okay, Dr. Faridah, your question is how, together with my GP practice, how do I incorporate this?
Yeah.
Okay. For now, of course, in our clinics we see normal patients, and also we incorporate lifestyle medicine practice into it. So, of course, lifestyle medicine practice, it involves behavioral coaching, a lot of training, a lot of consultation. So it takes a bit more time. So how we practice is any patients that comes with even a simple cough and flu, simple fever that comes, we will end the consultation with a lifestyle advice to begin with. So we will try to incorporate something, a very simple thing that they can start following, and then we will ask them to come get an appointment at a later stage for a detailed discussion. So that is how personally I manage patients with such a limited time, especially when we have a long patient queue waiting. And number two, of course, that is for active diseases. If those with chronic patients, of course, I will definitely take time. And again, lifestyle interventions and lifestyle advices really makes it important in Datin. So for my practice, I emphasize a lot of, besides treatment, I emphasize a lot of lifestyle.
Alright, so Dr. Prakash is using a method of planning multiple visits for different purposes, right? Okay, can I just ask Dr. Ellise, because it's the same lifestyle medicine, right? So I just want to know, what is your approach? Do you have any other approach, using any other kind of specialty or multidisciplinary approach in your practice?
In my practice, my group of patients will be divided into two groups mainly. So those are who having problem, and then they come and seek a solution from you. So that is pretty common among all the practitioners. So they have a problem, they have high blood pressure or high sugar, they come and look for you for a solution. Or another group of people is they are well, but they want to be greater. So that's a different group and different motivation. So my number one step that I will approach, my number one step is to understand why they are here today. Why today they have their life so many days. Why today that they realize that they need to incorporate some healthy lifestyle behavior changes. So number one, I will seek the internal motivation that bring them to me now. And I will let them, the step number two, I will do one is, I will tell them is where are they now and what they are looking for. So what is the gap? So how can we close the gap? So there are so many tools. We are a doctor, we are a prescriber. So lifestyle behavior changes is always our foundation. So we can prescribe therapeutic lifestyle intervention, of which you will learn in our lifestyle medicine board certification course. And we will learn how to coach your patient through with that. And then number two, that we have all the supplement nutraceuticals. And number three tools that you can prescribe drugs, right? So we are a prescriber, and also if you incorporate lifestyle medicine into your practice, you are not only a prescriber. For me, I think that they are looking for a healer. So it's make what is the intention that they want and what is the direction they want to go. So we close the gap for them. So I make sure that where are you now, where you want to go, and how I can come in to help you. But eventually, it's not me I go there, it's you that go there. I always tell my patient, if I can exercise for you 30 minutes a day, I will do for you. Unfortunately, I cannot.
Okay, that is very interesting approach. Alright, for Dr. Iman, right? Because of functional medicine is not really something that is not everyone aware about it, right? Maybe some people are aware about it, but they are not really into it because they have done and all. So how do you actually empower your patients when patients come to you for help? How do you actually make them, take your advice and showing them this is what you should do?
Okay, great question. Just sort of like what Dr. Ellise was saying, it's more of letting the patient be in the driver's seat, especially for functional medicine. So because in conventional medicine, it's 95% doctor and 5% patient. But in functional medicine, it's the reverse, right? So you're actually giving the power and the control to patient. You're acting as a guide, right? And when patient is in the driver's seat, they have more ownership, right? And so it's also a partnership. You're also taking the journey with patient, right? You're basically just acting as a guide, but yes, you're right, it's a little bit different than, it's actually a lot different than conventional medicine. But I feel that, when patients are, more empowered in terms of not just knowledge, but also taking the responsibility of changing their lifestyle, changing their diet, better sleep, stress management, all of that. And then, they feel that, okay, it's something that I can actually, control, and it's something that, I can also, take this journey and also have more control, I think. Yeah, that's what I would say.
All right, thank you very much. And Dr. Prakash, you mentioned just now you have started using a little bit of AI or technology in your management, right? So can you actually share with us again about how what kind of patients you actually use that, and what are the barriers into using AI? Because sometimes it will cost more to patients. Yeah, and then how would you maybe give us some example? How can actually this technology help you in your practice?
Okay, so basically what I've started in my practice is for diabetic patient, where we started using CGM, which is continuous glucose monitoring. So it is a device where we can install it at a hidden part of our body, and then it is directly connected to our app. So what happens is, once you're installed, we can have a real-time monitoring of your glucose, of your sugar level. That means we can, anytime, you can just monitor your sugar level at your phone. So every time you eat something, you can see in real time how much the sugar is going up, and how long it stays at the peak and before it comes down. So when I start introducing this, what I realized, the patient actually tends to know what food works for them, what food doesn't work for them, because it shows them, okay, if I eat rice, how much it goes up. If I eat noodles, how much it goes up. If I don't eat carbs, I only eat protein, I only eat fiber, what is the sugar level? So they can monitor it real time, and it increases their awareness, and it increases their motivation, because they can see life, they can just see life in front of their own eyes. So for an example, I have two best examples that I can give that you can really saw improvement in their sugar control after starting CGM. There's one 58-year-old gentleman, he's from Sabah. So he's a contractor. So prior to meeting him, he is diabetic for about close to 15 years. He was on 2 different medication, anti-diabetic medication. So I started CGM on him, and he is also obese. His weight was about 111 kilos when I first saw him. So after this introduction of CGM and a proper diet coaching, within 6 months down the line, so his HbA1c previously was 10.5. For the first time I saw him. So within 6 months, in a gradual period of time, he managed to achieve about 7. Of course, it is not optimal, but it is a great reduction by me cutting down 1 medication along the way. So when I first saw him, he was on 2 medication, obese, with 111 kilos. His HbA1c was 10.5, I think. And then right now, fast forward 6 months down the road, his HbA1c is 7. His weight has gone down by 10 kilos, and his medication, anti-diabetic medication, has been cut down by 1. So that's one example. Another example, a 55-year-old gentleman, he's a politician. Of course, when you talk about politicians, they are always busy, they don't have a proper routine, their diet is disrupted, their sleep is disrupted. So he has been diabetic for about close to 30 years. He was on 3 different anti-diabetic medications. Same thing, I saw him probably last year, December. So about 10 months now. So when I first saw him, his HbA1c was about 9. So right now, with 3 medications, so right now his HbA1c is at 6. So he is by actually my biggest achievement. His HbA1c is at 6. From 3 medication, he is now only taking 1 medication. Of course, weight loss and the proper lifestyle coaching together with the CTM. So this is how I feel innovative tools in medical field can actually really empower patients and really improve patients' lifestyle, patients' condition, and also contribute towards longevity of patients.
Thank you, Dr. Prakash. Dr. Ellise, in your lifestyle medicine patients, those that you are focusing on lifestyle change, do you use any kind of apps maybe or any kind of device that you would recommend to patients to use just to increase your motivation?
Yes, I do. I will introduce wearables. So wearables in terms of their watch, or now the much more easier one is ring. So I do introduce ring to them. Yes, so in the ring you can monitor sleep, you can monitor steps, you can monitor their daily heart rate variability. So those are the marker of what we so-called health and health optimization, longevity. So I do introduce ring to them. I have a set of ring size with me, so that after they test the size, then I will contact my supplier, then I will buy, they have the ring. So the ring looks something like this. I make it more fashionable. I normally put another diamond ring on that, or other thing, so that it doesn't look like a very boring ring. So most of my patients, if let's say they don't want a ring can be costly. The Aura ring is about 1,000 to 2,000 ringgit. So it can be quite costly for them. Then, if that way, I will advise for a watch. So there's so many watch. Depends on the phone they use. Not necessarily everyone must use iWatch, but I do monitor. But watch is not so nice when you wear to sleep. So again, I'm back to the ring. So if the person is really care about their lifestyle, they normally will invest in a ring. It looks nice and it gives you the number. So like for myself, my ring or my patient, if the ring is saying that your sleep is not enough, you're sleep deprived today, and it will impact your recovery, it will tell, my ring can tell about what is my brain waves. Then it will directly tell into my brain age. So if I see the number going up, if my patient is seeing the number going up, automatically the next day he will sleep longer. So it is like whatever measurable is manageable. So yes, I do put. Another thing that I will look at is the sleep, the quality, the duration, the deep sleep, the REM sleep. This one, number one. And number two that I'm interested is their step count. So in lifestyle medicine, we have 6 pillars. Number one is nutrition. Number two is movement. Number three is sleep. Fourth is stress management, avoid obesity, substance, and social connectedness. So mainly I focus on the top 3 first. So diet, movement, and sleep. So after the sleep, the next one I say is movement. It's not easy to tell people that you must exercise. The word exercise freaks people out. So how can I incorporate into that? It's normally we start small first. Small prescriptions, small win first. For example, 15-minute walks after your meal. So I always tell in a funny way, can you go for a romantic walk with your husband after your dinner? Hold hand, walk around, can have some romantic talk, so that they will remember, and next time when they do it, it's a lovely and positive emotion that you introduce to them. It's not only tell them, hey, go on, go exercise. It doesn't work. You have to exercise 115 minutes a week in order to achieve aerobic fitness. We all know that, but how to coach your patient, how to positively manage to influence them to pick up whatever they're doing. So that is the art, that what I learned in lifestyle medicine. So so I always incorporate like this, or I will tell them that if let's say my patient is executive, so every day I sit on the chair, laptop, everything. So how do you introduce movement into their practice? I go creative. I ask them to set an alarm every hour. So every hour the alarm ring, you go walk around and see what your staff doing. So one thing is you check on your staff whether they are doing work or not. Another thing you get the standing hour. And we all know that by standing at least 2 hours a day, it improves your all-cause mortality by 10%. If you stand 5 hours, it's 15%. Why you don't want that? You want that, right? So when you get your self movement, after that your weight loss is easier, you get fresher, and you make sure that your staff is doing work. So they feel like, oh yeah, let's do it. Like that. So my patient, they park their car further. if they are going to the toilet, they have to walk 2-3 times. They have hourly stand up and go and look for drink and look at the stuff. So I made it very doable and very creative so that they will remember like that. Yeah.
Okay, so thank you very much. So basically, we will actually advise them to use some kind of monitoring, and we actually monitor that.
Oh yes, because you have wearable. Even your iWatch will tell you how many active hours you have. So I always start small. Let's say we aim for 2 hours first. After that, you slowly, progressively, you increase that. So it's very, very doable. When they see, you only ask me to walk 5,000 steps a day. Okay, I do it like that. But we all know that you need at least 8,000. I said 5,000, okay, I still consider you sedentary. So I want you to be active. Then you need at least 8,000. But the first thing is they must have 5,000. If the person is 1,000 a day, do you give a goal of 8,000? Certainly no, right? So I will give about 3,000. So my tactic is, by 5 o'clock, can you open up your watch, your apps, to see how many steps you have achieved? If you haven't achieved, take out, go and walk around until you achieve it. So what do you do in between? You call someone you hate and talk to them. Or you call someone you love and start talking to them. Call your friends. It's not that difficult. Or listen to a podcast or listen to music and sing out loud. So all these things indirectly increase the movement, decrease the stress, and they are going to sleep better of the day as well. So there's so multiple of benefit when we incorporate positive lifestyle behavior changes into their life.
Right, thank you very much. I just want to ask your opinion on Iman, right? Because in terms of our
health coaches, also nutritionists, counseling, clinical psychologists, to manage different areas of these health issues, because the whole body doesn't function in silo. It's just an interconnected system. So we're looking at all different areas, like Dr. Ellise also mentioned just now, the sleep, stress, nutrition, diet, exercise. All of that is very, very important. But going back to your question, like what is it that I'm incorporating in terms of the healthcare system, you mean? I think maybe just having a lot more support from other clinicians. Also, it's more of integrative work that what we do. So it's not something that we do in silence. We also work with other practitioners as well. And certain things that where we feel a little bit stuck, we also do. You use more testing like DNA, genetic testing. Looking at other advanced biomarkers. So that's what I would do. Yeah.
Okay, thank you very much. So I would like to thank all our panelists for your thoughtful reflections and ideas and opening our mind. And so let's carry forward the idea that health is not simply the absence of disease, but also about vitality, resilience, and well-being, right? So prevention is always better than cure. So before I end the session, I would like to share a little bit about our society. So basically, Malaysian Society of Lifestyle Medicine, so is an interdisciplinary professional society. I have to stand up because I can't see them. Okay, society with vision to help Malaysians live a healthy life and to nurture a country that is free from lifestyle diseases. So our mission is to advocate lifestyle change among the public and to establish lifestyle medicine as essential in healthcare. Right, so next. Okay, so basically, our society is a part of a global alliances. So there are a lot of other countries in the world participating in this move. Next. So we are having a conference, our 5th Malaysian Lifestyle Medicine Conference at Berjaya Times Square from 27th to 29th of October. Okay, next. So there will be a lot of speakers locally and also internationally. Next. Dr. Siva is there, our founder and president. Next. And a lot more from all over the world, Harvard and all. Next. Okay, and next. Alright, so we at the end of this, usually every year, after the conference, we will have the examination for board certification in lifestyle medicine. Okay. Right, so our date for this year is on the 30th of October. Okay, so these are all the countries that are participating for the board examination and the centers. So we do have a booth outside. Please come to our booth to get more information on the society and also the board certification. Okay, with that, I thank all of you for your kind attention.
We're going to open up questions for the audience in the floor. Any questions from the floor so far? If not, we can scan the QR code that is going to appear on screen here, and you can post up your questions anonymously. But do we have any questions from the floor right now? No. Don't be shy. No, everyone. Yeah. All right. Well, thank you once again to our panelists and Dr. Faridah. Thank you. Please give them a big round of applause, ladies and gentlemen. Thank you.